the culture within SFU while you make new friends and explore what the community itself has to offer. Next slide. So the Global Connections program does have various events throughout the semester that you can attend. And as well as that, we do have peer support, which is one-on-one. Mentorship is a big part of the Global Connections program because our community leaders are then able to provide personalized support throughout the term. As well as that, we do also have members and community leaders making meaningful connections through this one-on-one mentorship and group socials and fun games and activities throughout the semester as well. In terms of transition support, the program offers very, very useful sessions about topics that help our members beyond their academic study. And the program also provides other opportunities for students from different pathways to share and learn about other cultures from each other. Next slide, please. So yeah, if you're interested in the Global Connections program, it's open to all SFU undergraduate students who are starting at SFU for the first time, or even who are transferring from other universities or from other countries as well. It's also for people who want to make friends across campus, make diverse connections, get one-on-one mentorship support, as we mentioned before. And it's also very, very helpful in getting useful resources from your peers in kind of a small, relaxed group environment while you can share your own community within the SFU community. Next slide, please. And another additional benefit is SFU has this thing called the Cocurricular Record, which is an official university document. It tracks your involvement at SFU or your experiences and mainly volunteer and paid experiences. If you do complete the program requirements with the GCP, which is the Global Connections program, your participation will be recognized on this record, and you also get a certificate of completion and a program t-shirt, which is an added bonus. Next slide, please. Yeah, so if you have any questions about the program in general, please feel free to contact us through the email that's on the screen at the moment. And yeah, next slide, please. I also wanted to briefly point out another thing you could check out, which is the welcome guides that's provided for international students, as well as domestic, I feel. We encourage everyone to check these out to help you prepare for SFU because it's a very specific guide and it's really, really helpful in getting you where you need to be. And there are downloadable checklists as well for new students. They're really helpful because you can find all the transition information you need in one main document. Next slide, please. We also have this thing called University Prep and SFU 101. These are both online courses that will help you prepare for your transition to SFU. And by now you would have received your invitation to University Prep 1. And if you haven't already taken a look at them, here's a bunch of reasons why you should. So the first University Prep course gives you basically a public set of information that's focused on welcoming students, and it helps you kind of understand a bit more about SFU and how SFU is actually a caring community. It also introduces degree planning, relevant services and supports that you may need, information that you might need before you enroll in your courses that also help you explore your course options. You'd also be introduced to SFU's faculties and departments, different course terminology, the academic calendar, which is super helpful in planning your semester and even your year ahead of time. Other things like academic advising and orientation events. And in terms of university prep step 2, this is where each faculty has its own unique course. Now, this is focused on course enrollment and building a balanced schedule. And it also talks about how your understanding of the how-tos of enrollment and degree requirements. There's also a lot of good information on faculty-specific events, which I encourage all of you to check out because this is very specific to sometimes your own degree as well as just the faculty in general. And you can also learn more about Indigenous student support, residents, living in residence, international student services, and a lot more resources as well. And for SFU 101, you'll find a lot of information on topics like navigating university life, accessing resources and services within SFU, and also getting involved in the community, whether that's in a volunteer capacity or joining clubs and societies and things like that. You'll also learn a lot more about being part of the SFU community and learning about what you and other students bring to the community as a whole. And on top of all of that, within SFU 101, you'll be a part of the HIVE program, which is a program for all new undergraduate students, which places you kind of in a small group with other new students from the same faculty. And yeah, thank you for inviting me to this session. I hope that was useful. If you do have any questions, please do feel free to email us at gcmp@sfu.ca.
Thank you, Janvi.
Thank you. I will pass on to Sophia.
Thank you, Hannah and Janvi. Hi, everyone, and welcome to SFU. My name is Sophia, and I'm one of the International Student Advisors Immigration Specialists working at the International Services for Students Office, or as we lovingly refer to it, the ISS. And I am very fortunate and I'm really grateful to be part of an amazing team here at ISS. For your information, I will be turning off my camera to save our bandwidth. So thank you so much for your patience. So I thought before diving into the immigration content of the session, it would help to provide you with a bit of context around what we do. At ISS, we offer a range of services to help support your transition to SFU as an international student. Essentially, we offer non-academic advising, so anything to do with your temporary resident status or documents as an international student in Canada. Our 5 immigration specialists are all regulated Canadian immigration consultants and are licensed to provide advice on your study permit, visa, on and off campus work regulations, and more. In addition, our team at ISS can offer advice on medical insurance and navigating the Canadian healthcare system, which you'll hear more about later in this session. We also provide transition support and intercultural programs like the ones Janvi has just described. And the ISS also includes our study abroad team, who coordinate international exchanges in field schools. You'll meet them later if you decide to incorporate an additional international dimension into your studies here at SFU. Lastly, ISS also provides support services for SFU students who identify as refugees or newcomers. If you're looking to connect with an international student advisor for questions about your immigration documents, work eligibility, or medical insurance, you can reach us in a number of ways. Our headquarters is located in the Maggie Benson Center at the Burnaby campus, and we are also trying to increase our presence in the Vancouver and Surrey campuses. We're also offering advising via a number of virtual methods, including email, live chat, which is an online messaging system, phone, drop-in, or booked appointments, which we conduct via Zoom. Another great resource, and probably the first one I would strongly encourage you to access when you have questions, is actually our website, where you can find the answers to most common questions. These are available 24/7. So we always recommend these self-guided resources as a first step to get your questions answered. I also included a barcode there, which you can scan using your phone. You can bookmark this right now so you can view it later. I've also included barcodes throughout my presentation, so watch out for it. But as Hannah mentioned a while ago, we will be sending you our PowerPoint through a follow-up email. So that's us, and what we do now as we move on into the immigration section of our presentation. I'll also just draw your attention to this disclaimer at the bottom of each slide. Particularly in the context of COVID-19, immigration policies can change rapidly and without notice. Thus, the information that we share today is current as of today, November 16, 2021. So let's get started. Today, we'll talk about some important concepts that you will need to familiarize yourself with as an international student in Canada. Next, I'll discuss the enrollment requirements for you to know what it takes to be considered compliant of your study permit conditions. Then we'll jump to travel entry requirements as well as your proof of vaccination requirements. First, visas and permits are not the same thing. Temporary resident visas, or TRV, is a travel document issued to those who are coming from a visa-required country. On the other hand, electronic travel authorization, or ETA, is a travel document issued to those who are coming from visa-exempt countries, except the citizens of the United States. So TRV and ETA are automatically issued to you if you applied for a study permit from outside Canada and have been approved. They do not give you legal status in Canada. They are just your travel document. What gives you status in Canada depends on what kind of permit you possess, such as study permit, work permit, or visitor record. If you'll be traveling to Canada for the first time, for the spring 2022 term, you will receive your study and or work permit at a Canadian port of entry. Your period of authorized stay in Canada is valid until your permit expires or until 90 days after you complete your studies, whichever comes first. So here are a few must-know items about study permits. First, as you're probably already aware, you must be holding a valid study permit for all in-Canada components of your program. Applications must be submitted online to the Immigration, Refugees, and Citizenship Canada, or IRCC. If you've not submitted a study permit application yet, we highly encourage you to do so as soon as possible, as the current processing time is 15 weeks. For those of you who are currently outside Canada, a study permit is not required for the period of time you're outside Canada. However, this will be needed when you're physically here in Canada, and you can only count the time spent studying outside Canada towards your future eligibility for a post-graduation work permit, or PGWP, if you apply for a study permit before you begin your program. So apply as early as you can. In response to COVID-19, IRCC has introduced some flexibility for students who are studying outside of Canada. The time spent studying outside Canada through December 31, 2021 will be counted towards the length of your postgrad work permit, and you can complete up to 100% of your program from outside Canada and still maintain your eligibility for postgrad work permit, provided that you apply for a study permit before you begin your classes and that the application is eventually approved. So in order for you to maintain your status in Canada, you must ensure that your permits remain valid at all times. This means that you may need to extend or reapply for your permits if they will expire before you complete your program. We recommend applying for a study permit extension 3 to 4 months before your study permit expires. I do want to note that an extension can only be applied for from inside Canada. If you're outside Canada and holding a study permit that has expired or will expire before you return, you must follow the process for a new initial study permit application and wait for approval before traveling back to Canada. Amongst other requirements, you must provide proof of your acceptance or enrollment to SFU as part of this process. If you are a brand new student at SFU, you must submit a letter of acceptance, or LOA. But if you've already enrolled for an upcoming term, you should also submit a confirmation of enrollment letter, or COE, downloadable via GoSFU. So going to the topic of transfer students, your things to do will depend on your education level and on at which stage of the study permit process you're currently in. So for the first row, for those who are already holding a valid study permit and are transferring to SFU from Fraser International College or any other post-secondary institution in Canada, you really don't need to obtain a new study permit, provided that yours is still valid. But if you've been admitted to SFU, you are required to notify IRCC of the change by completing an online process called the Designated Learning Institution or DLI transfer process. You can find the link to more information about this process in our welcome guides for new transfer students. Students coming from a high school in Canada do not need to do the DLI transfer process and are also not required to apply for a new study permit if yours is still valid. However, if it will expire soon, you may need to extend it or apply for a new study permit if outside Canada. If it is still valid and you wish to have an on or off campus work authorization in Canada, you will need to apply to change the conditions on your study permit and pay the applicable fee. So going now to the second row, if you applied for a study permit which is still in process using documents from another institution in Canada but will now start at SFU, you must submit updated documents such as an SFU letter of acceptance. You must submit this to IRCC before your application is approved. You can submit this via the IRCC web form. If your application is approved outside Canada and you did not include documents from SFU, then you must submit a new study permit application and wait for approval before you travel. It is also important to be aware of your obligations as an international student in Canada once you are here. In the next few slides, we'll talk about all these things to ensure that you're complying with the conditions of your study permit. As a study permit holder, you are expected to comply with the conditions of your study permit by actively pursuing your studies in Canada and making reasonable progress towards completion of your study program. From IRCC's perspective, this means that you must remain enrolled in each academic session during your studies in Canada. For undergraduate students, this means the spring and fall terms. Your study permit will also allow you to legally work on and or off campus under certain circumstances. To work on campus, you must be enrolled full-time at SFU in the term you wish to work. Generally speaking, full-time for undergraduate students at SFU means being enrolled in at least 9 units per term or a co-op work term. You can find the full definition on our enrollment requirements website, a barcode of which is included here on top of the screen. In addition, you must also hold a valid study permit, and that permit must include a condition printed on the document stating that you may work or may accept employment. As per IRCC's definition, on campus means that you can work at all buildings at SFU campus. An on-campus employer can be the following. I'll let you read it for a few seconds here. To work off campus, in addition to being enrolled full-time and holding a valid study permit with work conditions, you must be enrolled in a program at SFU that is 6 months in length and leads to a degree, diploma, or certificate. There is a limit to the number of hours you may work off campus. Generally speaking, you may work no more than 20 hours per week, but you can work full-time during scheduled breaks. For example, reading week, breaks between full-time terms, or the summer term for undergraduate students, provided that you enroll full-time in the terms immediately before and after that term. You will also require a valid social insurance number, or also known as an SIN. You will need this for any work you do in Canada. This number is used for tax purposes and is required for your employer to pay you. If you have applied for a study permit from outside Canada, please check the conditions when it is issued at the Canadian Port of Entry to ensure there is a condition stating that you can work. Without this condition, you won't be able to start working or apply for an SIN. If you're already holding a valid study permit without work conditions and are now starting your studies at SFU, you can apply to change conditions of your study permit to have the work eligibility remarks added. The process to change conditions is the same as the process for an extension or new application if you're outside Canada. If you are accepted into an SFU program, you will need a valid co-op work permit to do your co-op work terms. You can apply for a co-op work permit from inside Canada after you've been accepted to co-op. Your SFU co-op coordinator can give you a letter in support of the work permit application. After you complete your SFU program, you may be eligible for a post-graduation work permit for up to 3 years in length if you're continuously enrolled full-time in every spring and fall term. Apologies, give me one moment. For every spring and fall term throughout your program, with possible exceptions made in the case of part-time enrollments in your final term of studies only. If receiving a postgrad work permit after your studies is a priority for you, please ensure you maintain full-time enrollment in these terms starting right from day one of your program. Before I begin talking about traveling to Canada, I want to inform you that SFU has a travel and self-isolation guide available on our website. The self-isolation guide is SFU's approved COVID-19 readiness plan. It is a 5-part guide that will help you determine what you need to do before and after you travel to Canada. Even though it's 5 parts, I will only be explaining the first 3 parts today. Advisors are also available if you need support in completing the required isolation plans or help in understanding and using the information in this guide. Please don't hesitate to reach out to the self-isolation support team at cares@sfu.ca. Now on to the rules. As you're likely aware, to protect Canadians from the outbreak of COVID-19, the Canadian government has implemented some travel restrictions. These restrictions stop most non-essential or discretionary travel to Canada. Therefore, we highly encourage you to check the travel regulations and restrictions before you plan your travel. International students who are coming to study at an approved DLI will generally have their travel considered non-discretionary. If you plan to come to Canada as an international student, you may be able to enter Canada if, number 1, you have a valid study permit or have been approved for a study permit with a letter of introduction. And number 2, you are attending a designated learning institution or DLI with a COVID-19 readiness plan that has been approved by the province, such as SFU. If you're coming to Canada as an international student, it will be important to carry necessary documents to show that you meet the requirements for entry and that you're coming to Canada to study. These documents include, number 1, a valid study permit or a letter of introduction that shows that you were approved for a study permit. Number 2, a valid letter of acceptance from SFU. If you have enrolled for courses, you should also carry a current confirmation of enrollment letter or COE, which you can access via Go SFU. Number 3, proof that you have enough money to support yourself and family members who come with you to Canada. And lastly, if you have been living in a designated country outside Canada for at least 6 consecutive months in the year before you enter Canada, proof of a valid immigration medical exam may also be required. Keep in mind that medical exam results are valid for 1 year from the date of the exam. The medical insurance part will be covered by my colleagues later in this session. There are also documents you will need to carry to show you meet the health requirements to enter Canada, including proof of pre-departure COVID-19 testing that must be taken within 72 hours of your scheduled departure and show proof of your negative test results. Alternatively, if you have previously had COVID-19, you may show positive results from a test taken between 14 and 180 days prior. This would exempt you from the post-arrival testing requirements as well. Next, you should be thinking about your accommodation. Do you want to find your own or do you wish to book through SFU Cares? The SFU Cares program is available for students who need to self-isolate. Cares will provide you with a safe and supportive environment, meet necessary public health self-isolation guidelines, and help you to feel part of and connected to our community. Upon arrival at a Canadian port of entry, you will be given a COVID-19 arrival test. You can pre-register for your arrivals test to make the arrival process smoother. Note that there are some exemptions for those who are fully vaccinated, which I will be talking about in the next few slides. There are also quite a few requirements all related to ArriveCan, which is the Government of Canada's digital tool to help travelers comply with border measures. You can download ArriveCan on your phone via Apple Store or Google Play. I included a logo of ArriveCan at the top of our screen. All international travelers coming to Canada are also required to use ArriveCan to submit their travel information before they can board their flight or before arriving at the border for land travelers. You will need to provide travel and contact information, a quarantine plan, and a COVID-19 symptom self-assessment. If you have received final approval of your study permit from outside Canada, you should also complete the Vancouver International Airport or YVR Expedited Processing Submission Form. I included the link and logo at the top of our screen for your reference. This will speed up the process of issuing your study permit upon arrival. This one is optional but recommended to streamline your arrival process. Fully vaccinated travelers to Canada may be exempted from the quarantine requirements and day 8 testing requirements. The key word here is may, which means it is not guaranteed. Therefore, you must still prepare a suitable quarantine plan in case you do not meet the exemption. Just as a reminder, the final determination will remain at the discretion of a border services officer. So what do you mean by fully vaccinated? This means that you have received full series of an accepted COVID-19 vaccine at least 14 days prior to your entry in Canada. The list of accepted vaccines is shown in the next slide. So on the left side of your screen, you will see the 4 accepted vaccines in Canada, and you must upload proof of your vaccination in ArriveCan as well. Going on to the next slide. Once you know your travel date, you must also register and your travel and self-isolation plans with SFU as early as possible, since this will help SFU better coordinate supports for your travel during your quarantine period, including providing any needed support to you with developing your quarantine plan. We also have a free COVID-19 awareness training for students offered via Canvas to ensure safety and protection of our community. To recap, here is a table that summarizes the entry requirements for your travel to Canada during COVID-19. Generally speaking, your entry requirements will really depend on 2 factors. Number 1, your vaccination status, and number 2, whether or not you recently recovered from COVID-19. If you're fully vaccinated, then you're only required to provide proof of pre-arrival testing. You will not need or you will not be required to undergo the arrival testing unless you are randomly selected for surveillance. Even though you may be exempted from the 14-day quarantine and testing, day 8 testing rather, you must still provide a suitable quarantine plan. For those of you who have been only partially vaccinated or are unvaccinated, all these will continue to be required for you except for the 3-night hotel stopover, as this has been eliminated regardless of your vaccination status. The situation is a bit different for those of you who have recently recovered from COVID-19 and who have tested positive 14 to 180 days prior to departure. regardless of your vaccination, recently recovered COVID-19 patients will be exempted from pre-arrival testing, arrival testing, and day 8 testing. However, you will still be required to quarantine for 14 days unless you've been fully vaccinated, as you may be exempted for this one. But remember that you still need to provide a suitable quarantine plan. Please ensure to bring proof of your positive COVID-19 molecular test to qualify for this exemption. So here are a few changes on traveling to Canada, as well as some updates. As mentioned, the 3-night hotel booking requirements has been eliminated for all air travelers, regardless of vaccination status. If you or any of your family members are traveling to Canada with discretionary or non-essential travel purposes, this is now permitted, provided that the traveler qualifies as a fully vaccinated person. I'm also glad to announce that the suspension of direct flights from Morocco and India have resumed. Starting November 30, 2021, regional airports, including Abbotsford and Kelowna regional airports in BC, will resume accepting international flights. In the province of BC, you are required to present proof of your vaccination to access non-essential activities in the province, including living on SFU residence. Proof of vaccination may include your BC vaccine card accompanied with a piece of government issued ID, or if you're accessing a non-essential SFU activity, you may provide your SFU ID. For those of you who have been vaccinated outside of Canada, you can continue using your proof of vaccination from your home country together with your passport. However, if you wish to obtain your BC vaccine card, you must call the number on the screen so that the temporary personal health number can be created for you. Then you can upload your international proof of vaccination from your home country in the BC vaccine card online form. At SFU, please note that you are required to declare your vaccination status via the Thrive Health website. Alternatively, there is also a PDF form that you can submit to covid19@sfu.ca. Please note that at this time, only BC vaccine cards are accepted. The federal government of Canada is also introducing the Canadian COVID-19 proof of vaccination, which is different from the provincial proof of vaccination BC vaccine card. You will need this if you would like to travel domestically or internationally from within Canada as an air, rail, or marine passenger starting October 30, 2021. Please note that this document does not guarantee you entry to another country, as you will, of course, still need to comply with a country's travel entry requirements. Don't worry, there is still a transition period to do this from October 30 to November 29, 2021. During this transition period, a negative COVID-19 molecular test result will be accepted if taken 72 hours prior to your travel, or a positive test result for those of you who have recently recovered from COVID-19, the test of which must be taken within 14 to 180 days prior to your travel. If you have domestic transfer flights, your pre-entry test results will remain valid as long as your layover is no longer than 24 hours. You can obtain the Canadian COVID-19 proof of vaccination online, or you can also request by phone or in person by visiting a Service BC office. So finally, just to leave you with some few helpful tips. When it comes to your study permit, be sure to apply as soon as possible. If you're here in Canada with a valid study permit that is nearing its expiry, make sure that you apply to extend before it expires. If you're transferring to SFU from FIC or any other designated learning institution, don't forget to complete the DLI transfer process to notify IRCC that you will now be studying here. I know this is definitely an information overload, but I also want to reiterate that our website has a lot of resources that will help you with your planning at this time, both as a new SFU student and when trying to stay up to date on COVID-19 related impacts for international students. Please also be sure to continue monitoring the Government of Canada's websites for updates on travel restrictions. As always, if you have any questions whatsoever, you are more than welcome to reach out to us and we will do our best to help you and support you. So this is the end of part 1 of today's session. Now we will move on to our question and answer. As such, we will end the recording now.
All right. Hi, everyone. Again, for the second part of the session today, we'll be covering medical insurance at SFU and what the details it entails. In Canada, there are generally 2 types of insurance, primary and secondary. As international students, you must have adequate medical insurance for the entire duration of your studies. If family members are accompanying you, they should also have the adequate medical insurance during their stay in Canada. Primary medical insurance is composed of different components and also secondary. Next slide, please.
Primary medical insurance covers medically required services such as visits to doctors, hospital stays, and diagnostic medical testing. Primary medical insurance is legally required for all residents of British Columbia, including international students, and is provided through the BC Medical Services Plan, or also known as MSP. Secondary medical insurance generally covers extras that are not covered by primary medical insurance, such as dental services, vision care, and prescription drugs. Eligible SFU undergraduate students receive secondary medical insurance through the SFSS Health and Dental Plan. Next slide, please.
So this diagram shows a general timeline for primary medical insurance for those of you who are newly arriving in BC. Your temporary primary insurance coverage through GuardMe starts on January 1st, 2022, and ends on April 30th. You're automatically enrolled in GuardMe SFU plan when you enroll in your courses for spring. If you're arriving before January 1st, you may choose to purchase early arrival insurance. As soon as you arrive, you will need to apply for BCMSP. If you're already here, please apply BCMSP as soon as possible. There's a 2 to 3 month waiting period. And depending on when you arrive in BC, your BCMSP coverage start date will be different, and you may have some overlap period of BCMSP and GuardMe coverages. Next slide, please. GuardMe SFU is a temporary primary medical insurance coverage. The goal of GuardMe SFU is to help you transition while you're waiting for your BCMSP and to allow you have immediate access to medical services in Canada. As international students at SFU, you're automatically enrolled in GuardMe SFU plan for your first term at SFU and first term only. Please note, those of you who are transferring from FIC, this is the biggest difference. GuardMe SFU plan is only for your first term. Your coverage starts on January 1st and ends on April 30th, and we will not be enrolling you again in subsequent terms. The cost of this plan is $281 per term, and as some of you may have already seen it reflected if you're already enrolled in your student account. It is included in your student fees. You can enroll your dependent family members, such as spouse, common law partner, and/or children in your GuardMe plan with additional cost. If you will not be physically in Canada during the spring term and taking remote courses, you can opt out online by January 30th by completing out-of-country opt-out form. Please note, in this case, you must ensure that you have adequate medical insurance coverage upon your return. Please contact us before you travel. If you have been living in BC and already have BCMSP, you can also opt out by January 30th for full refund. To be eligible for refund, you must not have used GuardMe. A partial refund is also available if you have not used GuardMe and have received your BCMSP card before March 31st next year. Lastly, this might be the case for many of you, If you're planning to arrive in BC physically before January 1st from international locations, please note that you can purchase additional early arrival insurance through Gardmy website to have adequate medical insurance coverage upon arrival. Next slide, please. At the beginning of the term, you'll receive a welcome email from Gardmy SFU. This email will indicate a link to log into your account to view your policy details and submit your claims. You can also view and download your healthcare access card as shown on this slide, which is the proof of your insurance and will have your name, student number, policy start and end date. We recommend printing this out and carrying this card with you in your wallet at all times. This card can be used for direct billing at some pharmacies, medical clinics, and dental offices. And make sure to keep this for the future references as you need it for direct billing or submit a claim. Next slide, please.
BC-MSP is a provincial primary medical insurance, and all students staying in BC for 6 months or longer are legally required to enroll under the Medicare Protection Act. Unlike the Gardmy at SFU plan, it is not an automatic enrollment and cannot be done through SFU. If you are physically in BC and haven't done so already, please apply right away online, or you can apply as soon as you arrive in BC. For a new BC resident, you must fulfill the wait period of 2 to 3 months. For example, if you arrive in December, you will need to add January and February. Your BC-MSP coverage will begin on March 1st, 2022. Gardmy at SFU plan will provide you with medical insurance coverage during this period. To apply for BC-MSP, your current study permit must be valid for a period of 6 or more months. If you have any dependents, they can be added to your plan when you apply. The cost for BC-MSP is $75 per month for all study permit holders. It is called International Student Health Fee. You will receive an invoice monthly by mail, and you can make payments online, by mail, or by direct deposit. This charge does not appear on your SFU student account, and you are responsible to make monthly payments and maintain your account, such as updating your address and checking your coverage expiry dates, and update MSP with a new study permit when you extend yours. Next slide.
So I will be discussing secondary health insurance or extended health insurance. My colleagues Ricky or Hannah provided you with an orientation on what primary insurance you qualify for and you're eligible for. And so this is the secondary portion of your medical insurance. Next slide, please. For the interest of time, I'm going to skip this slide because it's just some reminders that have already been discussed earlier. But in short, secondary insurance just fills in the gaps that primary insurance does not cover you for. Next slide, please. So your secondary insurance comes in 4 broad categories. You've got the health plan, which covers you for things such as prescription drugs, for vaccinations, any mental health practitioners that you need to see. We have found that psychology visits have been a popular service in this category. So that is one service that is available to you under your health plan. And then we've got various paramedical practitioners such as physio, chiro, massage therapist, and so forth. This is not a full list. I will link a full list to you in the chat once that opens up. And then you've got the dental plan, which you are eligible for under this coverage, up to $700 for the 8 months that you are covered for. And your dental plan covers you for things such as regular checkups, cleanings, and these are any preventative services that you need to undertake. But it's also going to cover you for extractions, fillings, root canals, so any endodontics and any periodontic services as well. You've got the vision plan, which will cover you for any eye exams and any eyeglasses or contact lenses that you might need. And then you've got the travel coverage, which will cover you for academic trips and non-academic trips. So when it comes to a non-academic trip that you undertake, let's say if it is a vacation, you will be covered for up to 120 days per trip, and there are no limits on how many trips you can take. And then you've got academic trips, so any exchange, internship, study abroad, semesters that you are going for, as long as it is approved by SFU and facilitated through the ISS, you will be eligible for coverage throughout the trip. So whether that is 1 month, 2 months, or even 6 months, you will be covered for the entire duration of the trip, and including 120 days before and 120 days after your trip, just to give you that cushion. Just a quick caveat, because I know all of you here are international students, your travel insurance will not apply to you when you are traveling back to your home country. Another quick note, in order to get an acceptance letter from your host institution, if you are going for a semester abroad to a different institution, you will need a proof of enrollment or proof of coverage letter from Student Care in order to submit that along with your application package. That is something that Student Care will provide you. If you are not sure on how to get that, please contact the ISS and they will be able to refer you to the right place. But a good starting point is our office on campus, and we will be able to issue that letter for you. I will provide you with details on where our office is located later during this presentation. Next slide, please. So for 8 months of coverage, that is beginning in January 1st of 2022 until August 31st, your health and dental plan combined costs $169.58, and that is broken down by health and dental, as you can see on the screen over here. If you continue to be an eligible student starting September next year, so at the end of your coverage will end August 31st, and if on September 1st you are still an eligible student, you will automatically be covered for the next year. So starting September 1st until August 31st of the following year. So you don't need to worry about opting in. You don't have to worry about paying that upfront, because this amount is already billed in your tuition fee statement. So if you want to verify that you are covered starting January 1st until August 31st next year, please look out for this breakdown of health plan and dental plan in your tuition fee statement. And once you see that amount in there, you can be rest assured that you are covered under the secondary health insurance. If by any chance you have any dependents or any family members that you would like to enroll under this plan, and by that I mean any partners, common law partners, any spouse or children, you are able to enroll them for an additional cost, as you can see on the screen over here. For one dependent, it's basically ×2 of your current amount, so another $169. And for unlimited dependents, that is spouse and children, it is $339.16. Next slide, please. So as I mentioned earlier, your coverage begins on January 1st and will go on until August 31st of next year. Next slide, please. These are some important dates for you to keep in mind. And so starting January 4th until January 21st, this period is called the change of coverage period. And there are a couple of things that you can do during this period. The first one is opting out of the plan. So let's say if you have an equivalent plan from your employer, from your spouse, from your parent, or any other provider, as long as you have an alternative secondary medical insurance coverage, you will be eligible to opt out of your student care plan, and you will receive a full refund into your tuition fee statement. So that's one thing you can do during the change of coverage period. The second thing you can do is mix and match the portions of your plan. So let's say if you want to keep your health plan, but you want to opt out of the dental plan, or the other way around, you can do that during the change of coverage period. As it stands right now, you're automatically enrolled in the enhanced plan, but you also have the option of downgrading your plan to a basic plan. So if you feel that your health needs are not as prominent as you might need, you're able to downgrade your plan to a basic plan and receive a reimbursement for the difference between the two. The change of coverage period will also allow you to enroll any dependents into the plan if you have any. Next slide, please. Now I'm going to talk about a couple of ways in which you can submit any claims under this plan. Next slide, please. So the first way in which you can do that, and it's the simplest way, and I usually refer all students to use this option first, and that is the Pay Direct card. So similar to the Access card that was referenced earlier, this Pay Direct card is a physical or a digital copy of a card, which has all your information in one copy. As you can see on the screen over here, that is a sample of a digital copy of the card. So whenever you go to a practitioner, whenever you want to access your benefits, you simply show them this card and they will be able to bill the insurance company directly for the portion of the plan that you are covered for. So let's say, for example, you go to a dentist to get a cleaning done. Your plan covers you for 80% of that service. If you show them this card, the dentist will be able to bill the insurance company directly for 80%, and you would only be paying for the remainder of that plan out of pocket. And so it's really a simple way, and it reduces the work you have to do. The practitioner does all that work for you. There will be some instances, if it's a smaller practice, that practitioner might not have that that mechanism built into their practice, so they might not be able to send the bill to the insurance company directly. But that's nothing to worry about. As long as you have all your receipts, you will be able to submit a reimbursement through our website or through the mobile app. So the mobile app is available, on both devices to you, and it will allow you to submit a claim by taking a picture of your receipt and uploading it into the system. And then the system will start processing your claim. It will also allow you to set up a direct deposit system. So if you ever, submit a claim, your reimbursement will be deposited directly into your account, as opposed to waiting for a check in the mail and then having to manually deposit that. The mobile app will also allow you to access your travel policy. So whenever you are on a trip and you need to take a look at what your travel coverage includes, the mobile app will allow you to do that. And then the mobile app will also allow you to access a digital copy of the Pay Direct card, as I referenced above here. So in case you lose the physical copy of the card, as long as you have the mobile app, you will be able to get access a digital copy anytime. And then the online forms is sort of the most basic way of submitting any claims. This option is available to you, although it is a little bit of a slower process of processing claims. But if you choose to go that route, that is no problem at all. All the forms are available on our website at studentcare.ca, and you will be able to submit claims through that route as well. Next slide, please. So lastly, I'm going to talk about Student Care Network, and I'm going to explain how that works with an example. Next slide, please. So a Student Care Network is essentially a group of practitioners who have partnered with us to provide our students with exclusive discounts and savings, so that you don't have to, stretch your wallet too much when you're accessing your benefits, because we do understand sometimes, some services and procedures can be a little pricey, and so these practitioners recognize that that you are students and they want to provide you with that additional discount. And so I'm going to demonstrate how that works in the next slide, please. So this is an example of a dental network. So as you can see on the screen over here, preventative services, as I mentioned earlier, any recall exams, any cleanings or extractions are covered 80% under your dental plan. So 80% of that will be covered by the insurance. However, if you go to a dentist who is part of the savings network, you will get an additional 20% discount, and that brings up your total coverage to 100%. And that means you will not be paying anything out of pocket. It would be a fully paid for service. And so the same formula applies to a basic service. For example, your insurance plan will cover you for 70% of that. The network will give you a 20% discount. At the end of the day, you would only be paying 10% out of pocket. The good thing is that, a savings network will give you that discount even if that service is not covered under your plan. So as you can see, major restorative services are not covered under your insurance plan, but you will still get that savings if you go to a network member. you are not required, it is not compulsory for you to go to a dentist who is part of our savings network. Obviously, you are welcome to go to any practitioner as long as they are licensed and they are in Canada, anywhere in Canada. You can access your benefits through them. But if you choose to go to a savings network, you will get that additional 20% discount. We've also got savings network for massage, physio, chiro, vision, pharmacy, and various others. So it's not only for a dental service. And you will be able to see a full list of those practitioners who are around you on our website. It's an interactive system for looking it up. So you can look it up by campus, you can look it up by postal code, you can look it up by address, and you will be able to see those who are closest around you. And so next slide, please. I hope that information was helpful to you. I have linked some QR codes over here, and that's a good place to start, the homepage and the pay direct card as well. We have a student union, we have an office in the student union building in room 2301 that is in the Burnaby campus. And so if at any time after this presentation you have any questions about your plan, you can visit us during business hours and we will be able to help you out. We also have physical copies of pay direct cards. If you wish to pick one up from our office, you are more than welcome to drop by and pick one up. And yeah, with that, I will pass it to Ricky, and I look forward to your questions at the end. Thank you.
Thank you. Hi, everyone. I would like to provide a quick overview of our services here at SFU Health and Counseling. So we have a team of doctors, psychologists, mental health nurses available to help you during your studies here. Of course, due to COVID-19, many of our services are now both online and in person. So we will first see students online prior to inviting them for in-person services. If you need to see one of our providers, please call the numbers listed on this slide. An important factor to remember, due to medical laws, we are not able to provide any service to anyone who is not living in BC. Next slide, please. So as the transition case manager here at SFU, I provide support specific to students from international pathways and work to support them with their transition to SFU as well as their transition out, hopefully when you guys graduate. I provide a variety of support in different areas, including mental health, culture shock, finances, understanding different systems, the labor market, employment information, and much more. Feel free to connect with me. I'm happy to provide any type of support you may need. Next slide, please. At Health and Counseling, we offer a variety of programs to support you during your studies. We have group programs you can participate in, and we also have self-guided resources you can utilize anytime, even now. So please check out our website for more information. Next slide. As I first mentioned, if you're not in BC, we are not able to provide you with any services, but we have the MySSP program. This is a free mental health program available to any SFU student. You can access it even if you're not in Canada. The program is available 24 hours a day, 7 days a week, and you can call the number listed on the slide, or you can download the app from the Google Play Store or the Apple Store. Thank you, and I'll turn it back to Hannah.
Thank you so much, Ricky and Ali, for detailed information on medical insurance and services at SFU. So this is the end of part 2 and the final presentation of today's session. Now we'll move on to our second part of question and answer. As such, we'll end the recording now. For those of you watching the recorded version of this session, thank you so much for watching and welcome to SFU, and please do connect with us if you have any follow-up questions.